we are talking about the spectrum, the male and the female. The binary system is something which is a man-made thing. The God never created a binary system. We created a binary system just for the ease of our functioning in the society. That this is male, this is female.
You know, it's the craziest thing, because if you look at Hindu mythology,
Yeah.
and there are so many gods,
Yes.
वहाँ पे भी a percentage of the
Yes.
gods was transgender. So even in our stories, that percentage was holding up.
Yeah.
Why are we shocked? Why are we
Yeah.
surprised?
Unless we are giving that awareness, unless we are educating the society, this is going to go on. Again, we will not know where they disappeared, just like that from the society. And this is not a good sign of a growing society. Again, the problem is we are trying to make a bracket around them.
Yeah.
Okay, who are they? Who are they? They are us.
They are us. Hello and welcome to my new series, Second Opinion. In this, I call doctors of all specialities to have the conversations that you all want doctors to have. In this episode, I have with me Dr. Umang Kothari. He's a plastic surgeon who specializes in gender transformation surgeries. Now, this is a topic that even I, as a doctor, knew very little about. And so we dived deep into this. The discussion went into a lot of details, so I've divided this podcast into 2 videos. I hope you enjoy it. Let me know in the comments what you think and show some love to the video. I want people to first understand, right from the beginning only, कि gender है क्या? So when we talk about gender and you mentioned gender dysphoria,
Yeah.
what are these 2 terms?
Yeah.
तो transgender के बारे में भी बोल दो. What are
Yes,
these terms so
yes.
that our conversation becomes easier?
So gender is basically how I perceive myself as, the inner voice, or how I perceive Umang Kothari, or how a person perceives himself or herself. That's gender. Gender is something to deal with the brain. Gender is not something to deal with the sexual orientation. It's not something to deal with how you are expressing yourself as, or it's not something to deal with your emotional orientation. It is something to deal with how do you perceive yourself as, and that's gender. So
I think I am a man.
yeah.
That is my gender
That's
identity.
right. Yeah, that's right. Suppose now, for a matter of fact, suppose if I consider myself as a woman inside, my inner voice is of a woman, and my phenotype, that's how I am appearing, and my genotype, what my gene says, are of male. That means these 2 things are not congruent, and that is gender incongruence.
Right.
Where every night or every now and then, my inner voice will tell me, Umang, why are you wearing this coat? You have to wear a sari. Like I perceive myself as a woman. That's it. It's not pathological. It's a spectrum. And the only problem why people are not able to understand this, that they are pathologizing this. So
Yeah.
that is the problem with this.
Yeah.
And when we talk with the community, they're like, we're a part of the system. Why are you marginalizing us and then try to treat us?
Yeah.
There's nothing to treat us. We just want a healthcare or a society to be there for us. That's it. It is as simple as that.
You know, when I was reading about this for the first time,
Yeah.
I realized that this is not new for society.
Oh yes. Oh yes.
So, if I were to take a slightly different example, there was a point in time that if you were born to a carpenter's family, you have to be a carpenter.
Yeah.
And it was almost like, ये तुम्हारा धर्म है, ये तुम्हारा, like this is your destiny.
Yeah.
What do you mean कि तुम्हें carpenter नहीं बनना है?
Yes.
And the first people who said कि नहीं, just because I'm born in a carpenter's family, maybe I want to be a lawyer, maybe I want to be a doctor.
Yeah.
They had to face a lot of resistance.
Yeah.
आज के ज़माने में this seems so absurd.
Yeah.
Of course, everyone should be free to choose the job that they want.
Yeah.
I feel that we are going through that in terms of gender.
That's right. That's right.
Right?
That's right.
And conversations like this just clarify it, because it's not easy for society to face something they don't understand.
Oh yes, and you have to understand the society is changing every 10-15 years.
Right.
It is going to be like that. It's there in the past. It was there in the past. It is going to be there in the future. Maybe what we are talking right now will be irrelevant after 10-15 years.
Yes.
What you talked is about the job freedom. What we are talking is the gender freedom.
Yes.
The gender freedom will become so important or so usual, suppose after 10 years, 15 years down the line. But then there will be something else which we are going to talk about.
And we will remember fondly कि यार हमारे बचपन में सिर्फ gender dysphoria की बात चल रही थी, अभी देखो.
And that's what we have seen in some of the developed countries and societies. They have reached the epitome of this, and that's why many developed countries are right now opposing the gender selection, gender freedom. We have seen the Trump in US. He is declaring, or he has declared, there are only two genders. That's it. He is not now allowing the third gender in US, and that's by saying that those individuals who were getting the hormones from the public healthcare system, all the facilities, all the funds are stopped. Are stopped. So we are getting so much of inquiry from the Western world that if we are undergoing the procedure with you in India, will we get the hormones there as well? Because they are just left stranded there.
This is what happens when we try to solve a problem that we don't fully understand. What is so ironic is, since we are having this conversation in India, I want to highlight that Indian mythology is full of transgender stories. So this concept is not new. ऐसे नहीं बोल सकते कि ये आज के ज़माने. No. So can you throw some light on how Indian mythology has always been sort of pro this or has understood this?
So we have a very rich culture. We know this. The Indian culture is very inclusive. We are very rich in culture. The problem was we never documented it properly. We could not save it till today's world. I think that's why there was kind of lot of invasion and the disruption of the evidence and whatever happened to our country. But India, you have seen so many movies, you have seen so many mythological things that the transgender individual was very loyal to the royal families, and they were the part of the inner circles. They could give their life to safeguard that royal families and all this stuff. And this is not imaginary, it was there. But somewhere where the Britishers took over or they came to rule India, there were some laws like criminal law. And in that law, along with the thieves and the other antisocial elements, they have put transgender in under that category. And since then, we have seen that they are not the part of the mainstream, and they are still struggling sometimes to become the part of the mainstream. Since last 15-20 years, we are talking about it. We are trying to create a society which is more inclusive. If you see in many of the aspects, we are now getting decolonization, and then we are now coming up as a Bharat again. And right now, maybe that is the era right now where we are again going back to 300-400 years back, and we are again trying to create how the Bharat was. Something like that. More inclusive Bharat.
I want to ask, how big of a problem is this? Because we hear about this a lot, but in a population, what is the percentage of people who are going through this?
And you actually said the word which I wanted to debunk is a problem.
Love it. As soon as I said it, I realized that maybe that was not the right word. But
I was waiting for that.
But I'll say you
unless we talk about this, it's not going to get resolved. I mean, I want people to say this kind of thing, because then only you are debunking the myth. Unless you are a mistake or you do a mistake, you are not going to improve on that mistake. That this is not a problem. We are talking about the spectrum. The male and the female, the binary system is something which is a man-made thing. The God never created a binary system. We created a binary system just for the ease of our functioning in the society. That this is male, this is female. Okay. What about the in-between spectrum? We never thought of that. Maybe the percentage was low. It was good for the governing bodies and the kind of political bodies to kind of segregate these two as a majority. But unfortunately, on the long term, we forgot this segment which was non-binary, or maybe a binary but in the transition, or something like that. They are not problem. When we talk to the community people, they will always tell us, why are you considering us as something pathological or something, we are the problem. We are the part of the society. What we demand is only to the access to the healthcare and access to the society, access to the financial this thing. That's it. We just want that. We don't want you to come and talk to us and treat us, because we are not pathological. We are not problem. But yes, coming to your question, it is the prevalence, what we say, of gender incongruence is 3 to 5%. There are studies, there are pilot studies been done where they have taken a population, talked to them. Now, while I talk about this, we have to understand that when I consider myself as male and I am male, it is a gender congruence. Gender incongruence is something where the person doesn't perceive him or herself as how he appears, or the gender affirmed at birth. That is gender incongruous. But not all individuals having gender incongruence requires a healthcare need, or they don't require any transition thing. They are happy. They are okay. If that becomes gender dysphoria, then they seek some social transition or a medical transition and then legal transition, where they are in continuous fight that I want with their own brain and with their own self, that I'm just not happy and I want to be happy in my body. And then they start social transition, medical transition, and then at the end legal transition.
I was trying to make notes about this topic yesterday, and I realized one of the problem of this conversation is that when you say male or female, what does it mean to be man or a woman? We are actually talking about multiple things. Right? So in fact, I try to simplify it for myself. So when you say that someone is male, you are talking about 5 levels. So level 1 is, are they acting male? Like, is their expression male? Second is their identity male? So do they think that they are a male? Third is, are they physically male? And in terms of external physical features, so do they have a penis? Do they have testicles? So external physical. Then are they internally male? So they're inside the body, so the epididymis or all that, or in a case of a woman, if it's a uterus, ovary, do they have all of that? So internal genitalia. And then finally you can have hormones, and even deeper you can have chromosomes.
That's right.
So this is 6 levels of gender. And it can keep going, like 6
More
levels
deeper.
is a lot. Now, if I were to say I am a man, what I'm assuming is that I am a man at all 6 levels.
That's right.
But any of these levels can have any combination.
That's right.
So someone can be a female at chromosome level and male at hormone level and male at internal level. So that is a lot of permutations and combinations that can happen in gender.
I'll simplify this
Yes,
if I
please.
may. So mostly or mainly when the chromosome levels are decided, the hormones will always go with the chromosomes. Okay, so there is no permutation combination over here. Even the internal organs will always follow what chromosome says and how the hormones are being produced. Okay. In gender dysphoric individual, mainly is the identity, that how they perceive themselves as. So it's rather than going for 6 permutation combination, it is mainly how I perceive myself and how I'm appearing. Only that is permutation combination,
Right.
because that will make our life simpler.
Okay.
So suppose now
these
just-
two levels, expression and identity.
Yeah, and just to make it simplify for the audience, if I may,
Yeah.
let's take my as an example, that I am Umang. I perceive myself as male. I express myself as male. I look male with my beard and my kind of a voice and everything. I have a secondary sexual characteristics of male.
Yeah.
I perceive myself as male. If you take my genetic study, I will be XY, which is a 46XY, which is a
Yeah.
kind of genetic expression of a male.
Yeah.
So that's everything is in a line, and my hormones will be testosterone,
Yeah.
and my internal and external organs are of the male organ. So that means we are, or most of us are in a congruence of how I perceive
Right.
and what I'm given as a body.
Right.
Most of the individuals are in this zone, congruence. In incongruence, the terminology also varies, that AM, AB, which is a affirmed male at birth. So suppose if
Right.
I get a trans woman who does, and as a medical professional, your first thing would be what is your age and what is your sex. We all don't even say gender.
Yeah.
It is such a kind of engraved thing in our mind since
Yeah.
our training days.
Yeah.
Age, sex, age, sex, age, sex. But sex is not what we ask for.
I know.
We want to ask the gender.
Wow.
Gender.
That's true, because when we present history,
It's also-
we say 46-year-old male. We don't.
We don't say sexual. We don't say that. So sex and gender are been easily interchangeable
Right.
terms in education. I
Right.
mean, in a kind of medical education.
Yeah.
That is something which we, again, is a different topic altogether.
Yeah.
But they will say I am 25 years old, and the gender A, M, AB, affirmed male at birth. They will not say that I am male, like affirmed
Oh.
male at birth. It is again a good terminology to use for better understanding. Or a trans woman, trans men will write affirmed female at birth. Now this is again a very deep, because this gender was affirmed to them by the parents,
Yeah.
by the doctor, and by the society.
Yeah.
They have not perceived this as their gender.
So,
Yeah.
when a child is born,
Yeah.
that child will get affirmed a gender
Yeah.
based on this bottom four things.
That's right.
Right?
That's right.
Because a parent
Yes.
will only see the external genitalia.
Yeah.
The parent cannot see internal genitalia, but
No.
maybe you can do an ultrasound and check.
Yeah.
Nobody does that. You can check for hormones, you can check for chromosomes.
It's only external.
It's mainly only external.
Yeah.
But that child will grow up, and a child's identity will get formed, every year. So a 2-year-old child will have some identity, a 12-year-old child will have a stronger identity.
Yeah.
So somewhere between birth and the child having an identity, discongruence or incongruence can come.
Yeah. And this is again going to lead to a very interesting topic, which is differential sexual disorders, or
Yes.
DSD.
Yes.
Okay. And at the same time, the literature says that the gender identity can be as early as 3-4 years.
Wow.
As early as 3-4 years. And there are very individual pilot incidences where people are coming out in front of society since 8, and they are kind of historical studies, and everyone talk about these individuals. And interesting stuff. They say that I was always feeling like this since the age of 4 years. I wanted to wear certain kind of clothes. I wanted to do certain kind of things which was not matching my expression or my gender identity. But then over the period of time, some came out in front of parents. Came out means accepting or kind of telling the world that I perceive myself as this particular gender. Some came out in schools. They just stood up and they said, no, I perceive myself this. I can't do this anymore.
Yeah.
And so the gender identity and the external thing is something at 4-5 years you can think of,
Yeah.
that some individual is not matching with what has been given to them. Now, imagine a kind of incident where we see this is a very kind of cultural thing where when there's a newborn, you see a kind of a Hijra and a Kinder community people coming to your house,
Yeah.
and Then they celebrate the birth of the kid and everything. Now going back in the history, why this pratha started? Because suppose there is a ambiguous genitalia, the parents just could not understand what is to be done with this child. So they will either sacrifice the child, or they will just be in the kind of dark side ki how to grow this child as a boy or as a girl. This Hijra and a Kinder community will accept that child as their community member, will save the life, and then they will grow them with them. And it's always easy to convert a human body to female rather than to convert a human body to male. The moment you take the testicles out, the moment you take the organs out, automatically the endogenous estrogen is going to get risen,
Right.
and then you are going to behave as a woman.
Right.
Not completely though, but yes, that's easier process. You can't convert a ambiguous genitalia individual into the male, because you can, but there's a difficult task.
Right.
Okay. And that's how this pratha started.
Wow. So when you just said it, I realized that in history, the experts of disorders of sexual differentiation were the Hijra communities.
Yes.
Because the doctors didn't
Yes.
understand
Yes.
enough.
Yes.
Oh.
Now, imagine, and there's a law from the Chennai High Court, if I'm not wrong, it's from the Chennai High Court, that conversion therapy is illegal.
Okay.
Now, conversion therapy illegal, a lot of discussion happened that gender affirming surgeries are to be stopped now. It's illegal. It's against the law. But no, the conversion therapy, what they mean now, just consider a kind of a 5-year-old a person with DSD, and the parents went to a pediatric surgeon, and they were just out of the curiosity and anxiety, they were just not knowing that how to raise this kid as. And a surgeon, pediatrician, and the parent, they took a mutual decision that let's grow this person as female, and let us do some surgery to get the organ out, which is actually, at least you can raise them in a binary system.
Yeah.
At 16 years old of age, the person says, I'm a male. Why didn't you consider my input before
Right.
doing this surgery?
Right.
So the conversion therapy is mainly where the person's his will was not considered before doing any surgery. That is conversion therapy. While in a gender affirming care, they are coming willingly, their decision is there considered, and then we do the surgery. Or similarly, suppose there's a homosexual couple and the parents will say, okay, we will accept you. One of you may have to get changed into the opposite gender.
Okay.
For the societal acceptance, for the parental acceptance, if you love, we are ready to accept it. But since we are in a binary system, either of you may have to get converted into undergo the surgery and get converted into being a female or whatever.
So two men in love, the parents insist that
Or
one of you have
or
to...
a society.
Wow.
Or they do it because they want to live together, and in a binary system there was no space for that to happen.
Wouldn't they get gender dysphoria
No.
after that surgery because
No.
they are not women?
No. But
Oh,
see,
wow.
so that is conversion. What I meant to say, in a conversion therapy, these two category was criminalized. That you can't force an individual
To
to
convert.
undergo a gender surgery.
Right.
If that person feels, then definitely he or she undergo the gender surgery.
Right.
Not, you can't force, or that person's decision should be taken into the account
Yeah.
before doing this surgery. So conversion therapy is also kind of connected to this as well.
This.
The gender care clinic which we started is, no, let me speak. Otherwise I won't do the direction of the interview.
Okay. This podcast is sponsored by...
The gender care clinic.
Yeah.
So we are the very few service provider in the world to give certain kind of services, and we get the people across the globe. Like we get the people for clavicle reduction. It is a shoulder feminizing surgery. Or we get a people for lower rib removal. All across the globe, there are 6 to 7 surgical team, they offer this procedure.
Okay.
They are way expensive than what we do in India, but we get them in India. And my vision is to put India in the world map to that extent that we become the medical tourism hub for gender care. And we have the potential, we have the knowledge. There's already one clinic in Delhi, and very intelligent professor. He does only gender care, and he has put India on the global map.
Okay.
But right now, the Thailand becomes a kind of a bigger country.
Right.
There's a 1 year waiting there for the surgical transition.
Okay.
And I have a belief that if I train more, the India becomes the hub in the near
Incredible.
future.
Incredible. I think this is a conversation that, of course, needs to happen
Oh yes.
before people come for a gender surgery. And I want to talk more about gender surgeries.
Yeah.
I wanted to just finish that point that I was making, which
Of
is
course.
you said that 4% of
Yeah.
people have gender incongruence.
Yeah.
I look back at all our school years,
Oh yeah.
college years,
Yeah,
right?
Yeah. Yeah.
And I think all of us can remember that one boy or one girl in school who was a little different. And we kind of accepted that, matlab, that boy is different or that girl is different. She's a tomboy or that girl is very girlish or that boy is very girlish. Now that I think about it, that percentage holds up.
Yeah.
Like in a classroom of 100 people, maybe 2-3 students were like that. And one very crazy thought that I had was, I'm not sure what happened to them.
Yes. Yes. And
We are
I'm
not
getting the
keeping in
goosebumps.
touch.
Yeah.
Right? We're not keeping in touch. I don't know where they are.
Yeah. Yeah.
What happens to these kids?
Yeah. And you are very generous enough when you say that you accepted them as, but when I see my past, I must have
Yeah.
bullied them. And it gives me a lot of shame because again, I was not aware of this stuff. We are being brought up in a patriarchal society or whatever we want to talk about. But when we talk about this, when we see our past, unless we are giving that awareness, unless we are educating the society, this is going to go on.
Yeah.
We will not know where they disappeared, just like that from the society. And this is not a good sign of a growing society. This is not a good sign of a healthy society.
Yeah.
And that's the kind of message, at least I want to convey through this podcast, that consider them as a part of the spectrum. They are not pathological. They are not something you are supposed to find the cause and treat it. The problem is we are trying to make a bracket around them.
Yeah.
Okay, who are they? They are us.
They're us. Yeah.
Why are you want to investigate and diagnose it and then treat it where there is no problem as such?
You know, it's the craziest thing, because if you look at Hindu mythology,
Yeah.
and there are so many gods,
Oh yes.
there is Ardhanarishwar.
There is Ardhanarishwar, and
That
yes,
percentage is holding up.
Yes.
Wahan pe bhi a percentage
Yes.
of the gods was transgender.
Oh yes.
Even in other mythological stories, like there is, I think, Shikhandi, there are some
Oh,
characteristics.
yes.
There are some characters,
Yes,
right? In
yes,
Mahabharata,
yes,
Ramayana.
yes.
So even in our stories, that percentage was holding up.
Yeah.
Why are we shocked? Why are we
Yeah.
surprised?
Yeah.
Are there, I'm sure even in Greek mythology, the
Yeah.
hermaphrodite,
Yeah. Yes.
every single mythological collection of stories in the world
They were
had
always
this.
there. They were always there. They were always part of the. They were. They are. They will be.
Right.
It is not like they are not going to be there. It is going to be part of society. The problem, and this is a discussion when we say the Western world people come to India, whenever we have a kind of a conference or exchange of medical knowledge, and they also appreciate Indian culture
Yeah.
about all this inclusivity.
Yeah.
And I'm not very proud of saying this, but the Indian culture, unless someone else is going to come and acknowledge it, we don't feel proud about it. And that's is kind of very much thing which we should not be proud of.
Yeah.
We should encourage people to understand our culture, to read about our culture, rather than someone else coming to our nation and telling about, oh, you are very rich in culture since many centuries.
Yeah.
And you're like, acha, sachi mein?
Yeah.
So that is something more awareness and more education. So yes, gender incongruence was a part of the society. They were very much there. They were part of the loyal or a royal family and very loyal to the society. They were not harmful. They can never be harmful. I mean, I have not seen someone going very much against the wave and create a lot of nuisance. Of course, the some percentage are always going to be there. They must be having their own history, but they are very much in this part of the society.
I want to now talk about what happens next. So there are these kids, right? They are going through gender incongruence. Now I want to now follow their life.
I'll explain it to you.
What happens? How do they find the care that they want? Let's talk about gender transitioning and all the way till surgery. What are the steps?
So luckily, and I feel really proud in saying this, that I am been doing or associated with gender care since last 7 years, and my experience grew tremendously when I encountered certain individuals. When I talked to them, I was ignorant, I had my own prejudice, and which got sorted, and now there are such a beautiful human beings, are my very dear friends, and I talk to them regularly. And if you want to narrate some stories, there are stories like a big guy with a lot of masculine body coming to my cabin and saying, "There's Umang, मैं लड़की हूँ, निकाल इसमें से मुझे." Or there's a small girl child coming with a father कि सर मैं लड़का है, मेरे को इसमें से कुछ करो करके निकालो मुझे. And it has such a deep philosophy or deep emotions with all these individuals that you become the part of that life, and they really kind of acknowledge your effort as well. So suppose in a gender incongruent individual, some of them may just accept it. Okay, I'm gender incongruent. I don't want to undergo any medical care or any social care.
Right.
Okay, that's acceptable. This is pathological or a problem if they become or if they have a gender dysphoria. Gender dysphoria is again like a body dysmorphic disorder.
Right.
Just let me give you an idea. When I am also do a lot of aesthetic surgeries, I get a patient who will say कि सर मेरा नाक 6 मिलीमीटर ऐसा कर दो या मेरा लिप है ना 3 मिलीमीटर ऐसा कर दो, and they will keep on coming for more and more and more surgeries because they have a body dysmorphia. Dysphoria rather.
Right.
This is gender dysphoria where they want the correction of the gender incongruence.
Right.
Now, whenever they are gender dysphoric or whenever we encounter gender dysphoric individual, either they will do social transition or they will go from a social to a medical transition, or they will go from the social, medical and legal transition. Now imagine a spectrum from male to female or female to male or a man to woman and woman to men. If I have an individual who wants to travel the whole journey from here to here, there has to be a social transition. So society have to accept them as the gender they want, they are perceiving themselves as.
Right.
To do that, I need to do some of the hormonal change or some of the associated symptoms ka treatment and some surgical intervention. After doing that, the legal change will occur. Now, the law is very clear. The law says that if we are labeling someone as a male or a female, if they don't have the external characteristics, then we can't put them legally under that zone. Now, suppose a trans woman is under the transition. They have put some of the surgical thing, the breast implant, the voice change, but there is a penis, or there is an external genitalia, and the good amount of transition has been done. But if they want that legal document, Aadhaar card, passport, to get changed to woman, that's not possible. They can get a transgender card, TG card, and then there's a different process. The government has created a portal. So there is a in between a transgender persons act law, and they are very much acceptable in the society. But if there's a complete transition is to be happening or to be done, to have the document change As a woman,
Okay.
then there are some surgical things which has to be done,
Okay.
and then there's a legal or a surgical legal transition.
Okay.
So either some of them will settle with gender incongruence, they are happy with it. Some of them will only do social transition, or wear a kapda or wear a kind of outfit like the preferred gender.
Right.
They don't want any medical thing. It is a social transition. If they want something more, if they want their noise in the brain to get settled down, they may start hormones.
Right.
Because the moment they start hormones, we have seen there is something called gender euphoria at the
Right.
same time,
Right.
where they are now at peace. If they want something more, there will be surgical transition.
Right.
So, in medical transition also gets divided into mental health provider, those who are going to solve the associated problems,
Yeah.
or they are going to first rule out schizophrenia and other problems, and then going to say this that they are having a gender dysphoria, and the surgery and the medical transition will help them out. Unless that consultation is been done, we don't start hormones or we don't start
Got it.
surgical transition. Or there's a surgical and then there's a legal. So
Legal.
that's how it's called: social, medical, legal, medical into mental health, hormone doctor, surgical.
Perfect. I really like the way that this is explained. You said that there is a provision in Indian government where you can have transgender as a separate identity
Yeah.
between male and female. So somebody who is undergoing a social or only hormonal transition
Yeah.
can still be identified as transgender.
Yeah.
But would they want that? Would they be happy with that?
Yeah. So, as a healthcare provider, we are talking about it and we are evolving in our services. Even the law is changing.
Right.
There are good landmark judgment in the transgender law in India.
Right.
There's a NALSA judgment. There's a Transgender Persons Act, Transgender Person Law. So at least this TG card, which was not there before, it's
Right.
been offered to them. At least this transgender card, on this basis, they can ask for the rental apartment in the society.
Oh.
So accommodation and all these factors are very much important. When even in today's time, if you go to a society and tell them,
Yeah.
they will not accept. They will not allow them to stay in your society. You see any society in Mumbai allowing that.
Yeah.
They are very selected society. So at least on these laws and act, they can fight it out legally, or they have been thrown out of the society by the police sometimes, with the pressure from the society or committee members, whatever.
Yeah.
So all these things are very progressive when it comes to creating card or creating a kind of system. You will be amazed that these procedures are going to come under the Ayushman now. We are in talking terms with that, like the associations. And the Kerala government, they offer compensation or reimbursement for the transition procedures. The Tamil Nadu government has a free TG clinics offered as a public healthcare providers,
Right.
like in a government hospitals. In Mumbai, there are good amount of government setups. The Sion Hospital LTMC is a very known center. The plastic surgery department, they are giving these services since very long time,
Right.
free of cost.
Right.
So all those things are there. The TG card, and as you rightly said, some of the women or trans women may not like to be called or to be addressed themselves as a TG or transgender card.
Right.
But nonetheless, at least those who are okay with this, we are offering them at least.
Yeah.
They can, the one who are not liking this, they can complete the whole spectrum, come to this end,
Yeah.
and then get
Legally.
accepted legally as a woman.
Got it. On the other side of the spectrum, I just, when you were talking about it, I realized how beautiful this spectrum is, because I have friends who are male, identify as male, they live as male, and they're very comfortable with certain feminine characteristics, like say trying on nail polish.
Yes.
Right. And I think more and more society is also accepting them in the form of, oh, these are artists.
Yeah.
right? So they might keep long hair. So many rock stars have long hair. Long hair was considered as a feminine characteristic, and now suddenly it's not.
Yeah.
There are men who will put an earring, or they'll start wearing chains. Men's accessories is now a whole, billion-dollar industry. So this move away from a completely bracketed masculinity towards a sort of social experimentation with your feminine side
Yeah.
is not very uncommon. Now,
It's not.
more and more people are doing it. It's only a matter of how many people go all the way. So I'm guessing that every step there will be a huge chunk of people dropping off, and
Yeah.
very few come all the way here,
Yeah.
right?
So the idea is like, if we want to simplify this, is let's consider as a human body, and let's consider there are four important stuff or a thing in our human body, which is brain, heart, external genitals, and the skin. What you rightly told is about the expression, which is a kind of a skin and the external features.
Right.
And every one of these four organs has a spectrum from masculine to feminine. Okay. Now, we talked a lot about gender, which is a brain, how I perceive myself. I perceive myself as a male, as a woman. There are certain individuals that perceive themselves as animal, as cat,
Yeah.
as a dog. And there are some schools in abroad,
Yeah.
they have a separate litter box and separate sections for them as well. So that is something, the next step, which we may be talking about 5 years, 10 years down the line.
Because now when you say that, I find that I am uncomfortable with
Yeah.
that thought. I
Yes.
don't really know how to process that.
Yeah, maybe again ignorance. Maybe after 10 years that will become a normal. A certain other
Yeah.
podcast will be on that as well.
Yeah.
But right now that's happening in Australia, in US, where there's a kind of person perceives themselves as of a different, maybe alien.
Yeah.
We have seen so many, even a documentary or web series on certain kind of thing where people perceive themselves, they dress themselves, they walk having a different kind of features like alien, or they love to present themselves as a different species than the
Right.
humans.
So
That's basically the brain.
the brain. So as a neurologist, I know that identity is such a complex thing. You
Yeah.
can create any story that you want.
Yeah.
And if you really go into believing that story, you can start acting like it.
Yeah.
Right.
Yeah.
So at what point is it
No.
no? At what point is it okay?
Yeah.
And I think it's all right to have a boundary.
Yeah.
It is. And let society change, let that boundary change automatically. I think there is too much pressure on someone to be okay with everything.
Yeah.
At any given point, you will have some boundary.
Yeah.
And I think conversations like this is what helps you shift that boundary.
Yeah.
Right?
So yes, of course. So again, going back to the four things which I was talking
Yeah.
about, and I'll again come to the boundary, because there is something I want to touch that topic
Yeah.
again, is the artist thing and the nail paint thing.
Yes.
That's what I was talking about.
Yeah.
The brain, the identity is very complex.
Yeah.
Similarly, the genitalias will tell me or tell that person whether it's a gender is basically sexual orientation that can be towards the same sex or towards the opposite. It's basically homosexuality, heterosexuality, pansexuality, asexuality.
Yeah.
That's a spectrum.
Yeah.
The love also has a spectrum. The heart is love. That also has a spectrum. That I may love a woman, I may love a man, I may love a cat, I may love an animal, I may love a thing. So even the love has a spectrum.
Yeah.
The sexual orientation has a spectrum. The expression, I may love to wear a nail paint, I may love to wear a kind of ornaments.
Yeah.
So even that has a spectrum.
Yeah.
And the gender. But the problem, or the what we normally talk about, is educating the child or the younger generation about labeling the gender. That means how a girl is going to identify that opposite men or opposite men is a male or a female. It's mainly
Right.
the external features.
Right.
And that has been engraved in our brain since very early age. So I see a certain kind of phenotype or expression, and easily I will say it's a female.
Right.
ये तो male है.
Right.
Okay, so that's basically the gender and the expression is two different things.
Right.
Again, going to the thing which we're talking about, the expression
Yeah.
is, why are we keeping the legality and the protocols so strong when it comes to surgery? I mean, again, it's a
Yeah.
very different and interesting topic, because we don't want to go to that level that it becomes the freedom of expression, and then there's a kind of a downside of it. As you told, that we have to put an end to it,
Yeah.
and then have a kind of a conversation with
Yeah.
what are we looking at.
Yeah.
In certain liberal country, it was very much free. People went to another extent, and now they are seeing the downfall of this.
Yeah.
So India, by learning from these countries, we are now keeping all the SOPs, because
Right.
of which those who really want it will get the benefit out of it.
Yeah.
And those who are still in a kind of gray area, we will try to create something more for you, but maybe not now. We are under the process,
Yeah. Yeah.
and that is very much important.
I'm glad you brought up gender surgeries, because now I do want to talk about what are gender surgeries.
Oh yes.